From the outset of the pandemic, many health experts have shared the view that children were more likely to recover, be asymptomatic or mildly symptomatic after contracting COVID-19. However, children are reporting a host of lingering ailments, with some struggling to perform everyday activities. Experts in the U.S. have noted that severe fatigue and chronic headaches appear to be the most prevalent signs among children with long COVID. It was revealed that 2 to 3% of children who recover from the virus suffer both symptoms, according to Dr. Rochelle Walensky. During a White House briefing, she said, "We are examining long COVID in children and we are seeing long COVID symptoms, mostly fatigue and headaches." The co-directors of the Post-COVID-19 Pediatric Rehabilitation Clinic, Dr. Amanda Morrow and Dr. Laura Malone, said in a statement that long COVID in children could involve a wide variety of symptoms beyond fatigue and headaches. They said that further symptoms included activity tolerance, lightheadedness, cognitive complaints resulting in difficulty with schoolwork and mood symptoms. Jabs have saved more than 84,000, say PHE figures. They told Fox News, "We do not know the expected recovery time, but many of our patients are having improvements in their symptoms over time." It comes as a new U.S. study revealed this week that 2/3 of people who experience moderate coronavirus symptoms end up with long COVID. Researchers at the University of Arizona found that among those who tested positive for COVID-19, 68.7% experienced at least one symptom after 30 days, the threshold for long COVID. After 30 days, people with long COVID reported feeling fatigue, shortness of breath, brain fog, stress/anxiety, altered taste/smell, body aches and muscle pain, insomnia, headaches, joint pain and congestion. Don't miss Pfizer vaccine, 4 troubling side effects that mainly follow second dose of COVID jab, inside How to Live Longer, the anti-aging drink that can regulate cholesterol and blood pressure, tips type 2 diabetes, the sign on your toes of advanced blood sugar damage, doctor's warning, insight. Dr. Elaine Maxwell, of the UK National Institute for Health Research, told The Guardian, "We can definitely say that children get long COVID. But the problem with long COVID is that it is not one definition." What is long COVID? Up to 22% of COVID-19 patients suffer long COVID, stricken with symptoms like fatigue, brain fog and muscle pain. Experts fear that the number of long COVID patients could dramatically rise by this winter, following 3 grueling coronavirus waves. It remains unclear how many children may be affected by the syndrome, and for how long they may experience symptoms. Recent research estimated that there were 34,000 children in the UK suffering from long COVID. This includes 11,000 2 to 11-year-olds and 23,000 12 to 16-year-olds, according to a survey conducted by the Office for National Statistics, ONS. The ONS estimates also suggested that 380,000 people in the UK have experienced long COVID for at least a year. These figures are based on responses collected from people in private households in the 4 weeks to July 4. Overall, more than 945,000 people are believed to be suffering from the syndrome, down from 962,000 reported in the previous month. It comes as the Department of Health revealed that there were 32,700 new infections today, up from the 31,808 recorded last Friday. Cases have been rising week on week for 7 days, and deaths have also increased by 8.7% to 100 today. Related articles: How to live longer, 5 habits linked to a life free of cancer, type 2 diabetes, the sign on your toes of blood sugar damage, Dr. Fatty liver disease, signs of cirrhosis,